I would like first to give some background. The congenital LQTS syndrome is an inherited cardiac channelopathy that is associated with increased risk of sudden cardiac death, ventricular arrhythmia in young individuals, children, and especially women after the onset of adolescence. And this possibly may be due to the modulating effects of the sex hormones on the ion channel that is affected by this inherited arrhythmic disorder. And we know that in women, there's a change after the onset of adolescence in which estrogen and progesterone affect the ion channel, increase the risk. On the other hand, in males, there's a relatively high risk during childhood, but after the appearance of testosterone, there's a reduction in the risk of cardiac events after the onset of adolescence. So there are opposing trends, and in women, there's further increase in the risk of life-threatening events after pregnancy and during the perimenopausal period. However, the safety of all contraceptive use in women and by formulation type, whether it's progestin only, estrogen, or combined, has never been assessed in LQTS women. And for this reason, in the Rochester LQTS registry that comprises the largest registry in the world in the US of LQTS patients and their families, we started to administer a female-specific questionnaire in 2010, and now we provide for the first time data on almost 1,700 women who completed the questionnaire through March 2021. And in this study, we aim to identify the risk of life-threatening events, cardiac events, by all contraceptive use with and without beta blocker therapy, which is the standard therapy in LQTS syndrome, and to identify whether all contraceptive use is safe in LQTS women. So the major finding, and this was a little surprising, is actually that progestin-only formulations that are now administered to about 20% of the women who cannot tolerate estrogen or combined because of some side effects or risk associated with estrogen only. So progestin-only all contraceptives are associated with nearly a threefold increase in the risk of cardiac events, ventricular arrhythmias, and even sudden cardiac death in women with congenital LQTS syndrome. And this is especially more pronounced in women who do not take concomitant beta blocker therapy. Progestin-only oral contraceptive with beta blocker therapy appear to be relatively safe, and beta blockers, which is a standard medical management for LQTS syndrome, is associated with a significant 80% reduction in the risk of cardiac events in LQTS women who take or who use oral contraceptives that are dominated by progestin-only formulations. I believe this is a major finding in all LQTS women who are now considering oral contraceptives who should actually discuss with their physician how to manage this. And there are possible modalities. They can take estrogen only, they can take combined if they are likely to have adverse events from estrogen or combined, they can take progestin only with concomitant beta blocker therapy. But this is a finding that should be implemented in clinical practice, and even more importantly, or possibly a wider application. In the general population, there's also not only congenital, but drug-induced LQTS syndrome, and many drugs that we use now in clinical practice, like antibiotics, even anti-anxiety medications, are associated with a prolongation of the QTC intervals similar to LQTS syndrome. And in this case, we should also be concerned about all contraceptive use and evaluate the efficacy and possibly safety of all contraceptives in patients who are likely, especially women, who are likely to have drug-induced LQTS syndrome because the mechanism is similar.